Hello, I'm Dr. Yutaka Igarashi from the Nippon Medical School Hospital located in Tokyo. I'm an emergency doctor and a neurosurgeon. My responsibility starts at picking up the patient from the field by a physician-staffed ambulance, where I begin the emergency care. Once I arrive at the hospital, I'm in charge of the resuscitation, surgery, and intensive care. We are one of the rare institutions for the emergency treatment from pre-hospital to surgery to ICU. I have also been actively participating in rescue missions for international natural disaster sites, like in Nepali earthquake in 2015 and for the Great East Japan earthquake in 2011. Nippon Medical School Hospital is a university hospital with 877 beds located in metropolitan Tokyo, contributing to the research of advanced technology and is also a locally based medical care center. Japan's well-known bacteriologist who made a profound discovery on syphilis and yellow fever, Hideo Noguchi, also studied at this very institution. Hideo Noguchi's contribution to the advancement of bacteriology is celebrated as the face of the 1000 yen bill. Our department was registered as Japan's first emergency care center in 1977. Our center takes in patients with various critical conditions such as trauma, shock, cardiac arrest, stroke, acute abdomen, and acute intoxication. We oversee around 1,700 critical patients every year. JA Tech is trauma treatment guideline based on American Guideline Advanced Trauma Life Support (ATLS). ATLS set baseline on the ideal trauma care for patients being carried into ER. The guideline states the first step for resuscitation is primary survey for any physiological assessments. Both JTEC and ATLS define this step as the ABCDE approach, which stands for airway, breathing, circulation, disability, and environment. Once the first survey is over, we move on to the secondary survey for anatomical assessments. During the primary survey, X-ray is used to assess and resuscitate breathing and circulation. We take chest and pelvic images with X-ray machine. For the secondary survey, to determine anatomical abnormality, we take X-ray and CT. X-ray examination is necessary right after patient arrival to the hospital and after resuscitation. And X-ray examination right after hospital arrival is especially crucial. With patient at critical condition, accurate understanding of breathing and circulation damages and treating them in a safe manner is absolutely crucial. Xair can help with both. We do not have designated radiologists at ER, especially during the night. Manpower is low. Having an X-ray and being able to use it whenever needed provides us with more freedom. We can also use Xair with ultrasound during the invasive treatment to reduce the risk of complications. With primary survey, we deploy Xair a lot, but especially during trauma care. Xair is handy for invasive chest treatment like chest tube insertion, central venous catheter insertion, and cricothyrotomy, because X-ray is useful to avoid the risk of complications during trauma care. I personally find value in Xair during chest tube insertion to check the tip position. Although we use ultrasound to check the puncture position, it cannot visualize the tip. That is why X-ray is useful to visualize the tip position instantly. Of course, we can use fluoroscopy, but Xair is better for critical condition patients to reduce X-ray dose and risk with transporting them inside the hospital. Normal mobile X-ray units require expert knowledge, like arranging KV and MA setting before examination. Xair has preset condition, so all I have to do is click a button. We have no problem with the image qualities. I think the Xair image quality is as good as normal mobile X-ray unit. We have not done any retaking for emergency X-ray use. I'd like to take Xair out for pre-hospital setting in the future. In the physician staff ambulance or helicopter, we are already equipped with ultrasound. So if we can bring Xair to the ambulance or helicopter, we could potentially finish the necessary primary survey before arriving at the hospital. If such is possible, Xair can contribute significant time reduction before going into definitive therapy. Also, for COVID-19 patients, they needed to X-ray examination in isolated facility. I'm excited. Ultra-portable X-ray machine like Xair can provide solution to the need of the field.